We are here to discuss the vaccination plan in Santa Clara County for 5 to 11-year-olds as we await CDC's official approval. But we do have our plans going in Santa Clara County, and without further ado, I will bring up Dr. Marty Fensterscheib to give you the details.
Good afternoon, everyone. I'm Marty Fensterscheib. I'm the Vaccine Control Officer for Santa Clara County, former health officer. Thank you for coming today. Yesterday, an advisory panel of the FDA voted to recommend that children between the ages of 5 and 11 be eligible for a Pfizer COVID vaccine. The next step is for the FDA itself to adopt the recommendation and then for CDC to give its approval also. This means that vaccines could be administered to children as early as next week. So how are kids' vaccines different from the adult shots that are given of the Pfizer vaccine? Well, the dose will be a kid-sized dose, just 1/3 that of the adult version, meaning the kids' vaccine will be easily measured and safely administered to those kids. Like the other vaccines of Pfizer, it will be given as 2 separate doses, 2 shots, which will be 21 days apart. So full immunity will be reached 2 weeks after the second dose is given. The vaccine has been shown to be both effective and safe, 90% effective in preventing symptomatic disease in these children. The side effects were observed, but usually very mild, with pain in the arm, sometimes fatigue, sometimes headache, and some muscle aches. It should be noted, though, that during this pandemic, children have not been spared from getting infected by COVID-19. Nationally, we have seen that 1.9 million children have been infected, over 8,300 hospitalizations, and 1/3 of those were in intensive care units. More than 2,500 cases nationally of multi-system inflammatory syndrome, which is that rare but serious complication of COVID-19 infection in children, where they see rashes and fevers and inflammation and swelling of organs such as the lungs and the heart. And children with underlying health conditions are even higher risk for COVID. Those with diabetes or asthma or obesity. However, 1/3 of the children that were hospitalized nationally showed absolutely no underlying health condition. And nationally, recently, kids between 5 and 11 made up nearly 11% of the cases of COVID infections in early October this year. So vaccinating these children will keep them even safer in school and during their school activities and their activities at home with their families. So today we want to urge parents of children in this age group, 5 to 11, to develop their plan for getting their kids vaccinated. And certainly if they have questions, to call upon their own health professionals to answer those questions so that they are ready to have their children vaccinated next week or soon after. Vaccines will be arriving in our county next week and in the coming weeks. We don't anticipate any shortage of vaccine this time around. In the first week, we do expect over 55,000 doses of the pediatric formulation of this vaccine to come to our providers in the county, and that includes more than 11,000 doses to our retail pharmacies. Parents will have the option of going to many different locations to take their children to be vaccinated. Planning is underway now by healthcare professionals and our systems, including the pharmacies, to make the vaccine available as soon as it arrives. We will also be focusing on making sure that all children in our county have very easy access to vaccines. And so I can take questions. Oh. Should I stand there or no? Yeah, go. Okay. Without going to questions, we will start over with PTV. So the question is, how soon can I get my child vaccinated? So I mentioned that the FDA acted yesterday. They have to then send that recommendation over to the CDC. The committee of the CDC, which is called ACIP, will meet on Tuesday and Wednesday of next week. And then we hope that the CDC director will then approve that recommendation. And so we should have shots in arms, hopefully, if everything works out, by next Wednesday and Thursday. Right, so the question is, we already have Pfizer doses, adult doses, so why don't we use those? First of all, the FDA says we can't use those, and the reason is because the formulation is different, and we want to make sure that the kids receive a safe dose, and for that reason, the Pfizer has formulated a new special dose, which will come in an orange vial, which you hopefully will have some next week, and we can easily draw out the amount that is safe and has been approved for children. So we cannot use the adult vaccines. How big is the population? I happen to know those numbers. 28 million kids that age in the United States, 3.6 million in California, and 167,000 kids in this county that are between the ages of 5 and 11. Okay, so the question is, how many do we have to vaccinate to get up to our 80% so we can get rid of our masks? We did look at that number. Number one, we hope that all of the kids will get vaccinated, and not just the minimal number. We hope all of those. We know that parents will have questions, and we want them to get their questions answered, and so that they vaccinate all their kids. But currently, if you look at where we are now, at about 73% total population vaccinated, we would need about 55% or so of those kids vaccinated to get up to 80%. But as I said, we want all the kids to get vaccinated. The question is there a benefit of doing it now and not waiting till it gets full approval? Yes, there is a benefit. We have kids going to school right now, and we are doing very well. We haven't seen many cases in schools, thank goodness, but they are wearing masks and keeping socially distanced. But this is just the next level of protection. So we want to make sure kids are extra safe at school, and also to open up their lives so that they can participate in other activities with their families. So yes, now is the time. Approval will come eventually, but now's the time to get your child vaccinated. I would tell parents that are on the fence right now to talk to their private or clinic doctors, their provider, and make sure that they get all their questions answered, because I think it's something that they really should talk to their provider about for their individual concerns at this point. Yeah, so the question is, where will the access be for vaccines? We have outreach to private physicians and making sure that they have vaccine in their offices. We said that pharmacies will have vaccines. All of our community clinics will have vaccines, and we have been planning with schools to provide clinics in schools, and we are onboarding those schools now, making arrangements for those clinics. And we'll have more information next week on all of the schools that will have clinics. Yeah, well, kids in schools are going to keep their masks on. So again, this is another layer. Just because we're vaccinating and getting these kids vaccinated doesn't mean they're all going to take off their masks at this point. So it's an extra layer of safety, but for the time being, their masks will stay on. Should we get this population vaccinated to prevent a winter surge? Absolutely. The more we get vaccinated, the better. We're doing very, very well. We just hit the 85% total vaccinated in this county of 12 and olders. And so we want to get this next group of eligible kids vaccinated. It's certainly going to go a long way to keeping the case numbers low and keeping us safe during the winter. So everyone do their part. Get your kids vaccinated. Any other questions? Right, so how are we going to deal with potential rush in vaccine? As I said, we should have 55,000 doses or more coming into the county next week. That represents, if you do your math, about a third of all of the kids that are 5 to 11. So we think we can handle that. If people have to wait, it'll only be probably another several days or weeks for the vaccine to be available by their provider. But we are anticipating that there will be some rush for people that want to be first in line, but we think we can handle that given all the providers across the county that will have vaccine. Yeah, well, after what's our assessment of COVID cases right now? We have certainly seen a downsizing of the surge that we had, but cases are flattening out, and we're not seeing any further decline. Things have been pretty stable over the last couple weeks. So we hope that this is not the beginning of a surge, but again, right now it's totally stable. Yeah, we will have to get back to you with that. I had asked our data people this morning, anticipating that question, but they're putting that information together, so we will have that information. There are kids that have been infected in this county, of course. I just don't have the number. Yeah, so the question is about vaccine hesitancy in parents regarding this age group. We don't know. We certainly are hearing reports that parents had concerns. And so I think that we just have to make sure that the medical community can provide all those answers. There definitely will be some hesitancy, and we want to be able to answer the questions and provide the best possible information for parents to be able to make their own choice about their children.
So the 7-day rolling average has been at about 130, 140 cases per day for a couple of weeks now. Do you think with the vaccination of the kids, do you think that number's going to start ticking down?
It's hard to say right now whether that rolling average of cases is going to drop. It's been stable. We're moving into winter. Again, if people continue to be vigilant, that will be helpful. But again, going inside and not being outside as much, although our weather is nice here, certainly may cause additional infections. We want to, again, also urge all of those adults, and there are a couple 100,000 adults that still have not had a single dose of vaccine, and we really urge everyone to get their vaccine or get their series started at this point.
We'll go final question, NBC.
Yeah, I mean, the question is about, well, kids may not get a bad infection or a serious infection. I guess in most instances, children actually don't get very, very serious infections. They get more on the milder side. However, you heard my numbers earlier today. There have been 8,300 hospitalizations, and a third of those were in intensive care units in this country, and that also that complication of the inflammatory condition is definitely very real. There's also been issues and cases of long-term COVID in these kids. So I think it's definitely of benefit to get the vaccine for the children, because the risks of the disease are much worse than the vaccine side effects, which are minimal.
Great. Thank you, everyone.
Okay, I'm going to attempt to just do a little Spanish. Where I finish, Ricardo can come back. Okay, buenos días. La vacuna para los niños de 5 a 11 años será autorizado en la próxima semana. Han hecho esa vacuna especialmente para los niños. Un dosis para niños es solamente un tercero del dosis de los adultos. Esta vacuna es segura y efectiva para los niños menor de 5 a 11 años. Los niños necesitan recibir 2 dosis de 21 años después de la primera. Con vacunación se presentan efectos secundarios muy leves como dolor en el brazo y dolor muscular también, dolor en la cabeza. La mayor manera de proteger a los niños y toda la familia contra la COVID es vacunarlos. Entonces, pedimos a todos que hagan un plan para vacunar a sus hijos cuando la vacuna será autorizada la próxima semana. Gracias. You want to do it?
Kính thưa quý vị, FDA đã chấp thuận sử dụng thuốc tiêm ngừa cho trẻ em từ 5 đến 11 tuổi với một cái liều lượng ít hơn so với liều thuốc tiêm ngừa dành cho người lớn. Và các em cần phải tiêm 2 liều cách nhau 21 ngày, tức là 3 tuần. Thuốc tiêm ngừa COVID-19 hiện nay vẫn là phương pháp bảo vệ chúng ta hiệu quả nhất để chống lại siêu vi khuẩn COVID-19. Việc các em được tiêm ngừa đầy đủ sẽ giúp bảo vệ cho các em, cho gia đình, bạn bè, trường học và cả cộng đồng của chúng ta. Nếu được CDC chấp thuận, và chúng tôi nghĩ như vậy, thì trẻ em sẽ bắt đầu được tiêm ngừa bắt đầu từ ngày 4 tháng 11 tới đây. Phụ huynh có thể lấy hẹn từ bây giờ trên trang mạng sccfreevax.org. Vì liều tiêm cho trẻ em sẽ khác với liều tiêm cho người lớn, chỉ 1/3 của liều bình thường, nên chúng ta phải chờ số thuốc dành riêng cho trẻ em được gửi đến và không thể dùng thuốc hiện có của người lớn. Sở Y tế Công cộng hạt Santa Clara sẽ kết hợp với các trường học để đưa ra các địa điểm tiêm ngừa tại các trường học để các em có thể được tiêm ngừa một cách thuận tiện và an toàn. Hãy liên lạc với trường học của các em để quý vị có thể tìm hiểu thêm về những địa điểm tiêm ngừa dành cho trẻ em tại trường học. Tại địa điểm tiêm ngừa của COVID-19 này, tất cả trẻ em từ 5 tuổi trở lên và gia đình của các em sẽ được tiêm ngừa hoàn toàn miễn phí. Và cho dù có tình trạng di trú nào đi nữa, và cũng không cần phải có bảo hiểm sức khỏe. Quý vị sẽ nhận được đơn để điền trước cho trẻ, và quý vị cần ký vào cái đơn này nếu như quý vị không có mặt bên cạnh các em trong lúc các em tiêm ngừa. Và nếu các em đến với cái giấy mà đã được ký này thì các em sẽ được tiêm ngừa và quý vị không cần có mặt. Xin cảm ơn. Chúng tôi là Như Hạnh, nhân viên truyền thông của hạt Santa Clara.
大家好，我是圣塔克拉拉县紧急行动中心的 Anchen。圣塔克拉拉县已经准备好，一旦被批准，就会为县内5到11岁的儿童提供新冠肺炎疫苗接种。目前，美国食品药物管理局的咨询小组已经同意辉瑞疫苗在5到11岁儿童的使用。美国疾病与预防中心将对此做出最后的决定，最快在下星期3就会有结果。儿童疫苗的剂量会比成人剂量少，是成人剂量的1/3。鼓励家中有此年纪儿童的家长可以事先的做好计划，带孩子去接种疫苗，来对抗新冠肺炎。鼓励是 疫苗是结束大流行的重要工具之一，接种疫苗能够更好地保护自己以及家人的安全健康。像12到17岁的青少年一样，5到11岁儿童接种疫苗时，不一定要家长或监护人陪同到场，但是必须要有家长或监护人事先签署的免责声明书才能够接种。家长可以和孩子的家庭医师讨论接种疫苗的事宜。疫苗是免费的，不需要保险，在医疗诊所、地方药局以及县府的营运的疫苗站都可以接种。也鼓励年满18岁以上符合条件的民众去接种疫苗的加强剂。更多疫苗的资讯或者是预约打疫苗，可以上圣县疫苗网站 scc.freevax.org。祝大家平安健康。Next, Jim Bill will be providing a statement in Tagalog. Thank you.
Magandang umaga mga kababayan. Ako po ay si Jim Bill Batuampo, Public Information Officer ng Santa Clara County. Magandang balita. Inaprubahan na ng FDA ang bakuna para sa mga batang nasa edad 5 hanggang 11 taong gulang at ang mga bakunang ito ay may mas maliit na dosis. May iba pang proseso na gagawin ang ACIP o CDC bago masimulan ang pagbabakuna. Hinihikayat namin ang mga magulang na gumawa ng mga plano para sa kanilang mga anak na tumanggap ng bakuna para protektahan ang kanilang sarili, kanilang pamilya at kanilang mga paaralan. Dapat tayo ay magkaroon ng pasensya dahil kailangan nating maghintay para sa mga bagong supply ng bakuna na partikular para sa mga batang nasa edad 5 hanggang 11 taong gulang. Ayon sa mga alituntunin ng federal at simpleng hindi maaaring gamitin ang mga extrang doses ng mga adult. Ang county ay nakahanda para simulan ang pagbibigay ng mga bakuna kaagad at magkakaroon ng mga masasayang aktibidad para sa pediatric group tulad ng mga scavenger hunt, papremyo at iba pa. Ang mga drive-thru na option ay magiging available at mayroong train staff sa paghawak ng mas batang pasyente. Kailangan pa rin na may kasamang isang magulang ang magpapabakuna na bata o kailangan permahan ng magulang ang isang waiver. Para sa karagdagang impormasyon tungkol sa bakuna, pumunta lamang sa scc.freevax.org. Maraming salamat.